Wake up. It's the Sleep Unplugged podcast, episode 145. Hypnic Myoclonus. Jerk your body. Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I'm a neurologist, sleep specialist, and your host for this episode of the podcast. If you're new to the Sleep Unplugged podcast family, welcome. If you're a veteran, welcome back. We are really, really glad you're here. If you want to get in touch with the show and talk to us, you can easily do that most easily through my social media. That is Dr. Chris Winter Instagram, Dr. Chris Winter Twitter, Dr. Chris Winter Bluesky Threads. We have a YouTube page where we post all videos of our content. We also have a Spotify music playlist where we compile a list of all the songs we reference in the titles of the podcast. And today's episode is no exception. In fact, I'm really excited about the song and the artist this week, and we'll get to it in just a second. I wanted to, this week we have no sponsor, so I wanted to highlight a couple comments, corrections, criticisms, and every now and then I like to go to reviews of my books. I've written two books, The Sleep Solution, Why Your Sleep's Broken, How to Fix It, as well as The Rested Child, Why Your Tired, Wired, or Irritable Child May Have a Sleep Disorder and How to Help. The first review I'm going to read is from Amber, who wrote, Hope Restored. I was struggling with insomnia that was progressively getting worse for 2.5 months, 6 months postpartum after multiple medications and interventions that didn't work consistently. I had lost hope that my sleep would never get back to the 8 to 9 glorious hours I used to get. It wasn't until I met Dr. Winter and read his book that really made things click for me about what insomnia is, what it isn't, and how to fix it for good. I read the book in 2 days. It's it's not a heavy lift. Lots of pictures. I'm just kidding. It was fascinating taking complex concepts and simplifying them for non-neurologist types to understand. Thank you, Dr. Winter, for writing this book and for restoring my hope that sleep is fixable. The next night, I was sleeping 6.5 hours and have been so for the last week. Well, that's awesome, Amber. I'm so excited for you. The other one I will read is from Allison. She wrote, This man saved my life. I'm not exaggerating when I say that I owe Dr. Winter my sanity. In 2021, I had retained placenta that had caused postpartum hemorrhage, deeply traumatized by my near-death experience. I developed insomnia that followed me around like a terrifying specter of death for years. On one occasion, I lost 30 pounds in a few months because I was so anxious about not sleeping that I had no appetite. I was able to keep myself from totally losing the plot with the sporadic use of medication to help me sleep. But I knew in the back of my mind that one day the medication would fail, and I had no idea what to do then. Cut to late 2024, I decided to have another baby, and I was developing debilitating and terrifying insomnia again. This time, I saw no out to my suffering and was convinced the stress I was experiencing would either kill me or send me to the hospital out of desperation. I found this book, and the turnaround was almost immediate. I laughed a lot reading it, had a ton of aha moments, and then set the book aside and went back to sleeping normally again. It goes on, but I just think that those are just two wonderful sentiments and really illustrate what we talk a lot about on this show when we talk about insomnia. Of course, we talk about insomnia first Monday of every month. We will talk about a really interesting insomnia topic next week. That people are going along, minding their business, sleeping well, and then something happens. And I found it really interesting that two consecutive reviews of the book had to do with pregnancy, something we think of generally as being very positive, awe-inspiring. And you can see that precipitating event happen in both of these individuals' lives, that suddenly they're in a mire. And I love Allison's descriptive language, the specter of death. I mean, this is the kind of conversation we have about insomnia. So it's so, I can't tell you how exciting it is for me to get a review like that. That even if the rest of the reviews for the rest of this book's lives are all 1 star. I hated it. I don't like his humor. There was a review. I couldn't find it, but I'll find it for maybe next week. Or, coming up next week is our April Fool's Day episode. I forgot. And we generally read the top 10, funniest or most scathing comments that I've gotten over the years. So maybe I'll find that one that this person did not like my book and said I've spent too much time trying to be funny. Um, it's interesting when people think you're trying to be funny versus just crap comes out of your head and you find it funny or not, but it's not like I'm trying to have that thought. I always think about the Mickey Mouse hands reference the first book that I didn't want to think about dreaming about having Mickey Mouse hands. It's just something that pops into your head. There was no try involved there. So, like it or not, there wasn't a whole lot of effort. But anyway, Allison and Amber, you've made my day. So the musical reference this week for the podcast is one of my favorite artists, favorite songs. I was thinking about Prince this week because it was a great New York Times daily podcast about this incredible documentary that was made about Prince by the same guy who did the documentary on O.J. Simpson that won all those awards. That basically the Prince estate said, no, you're not allowed to release it. And Netflix, who was funding the whole thing, basically said, we don't want trouble. Let's not release it, and we'll just make another season of Virgin River, like to placate the masses. Like, let's not do anything too artistically daring. We'll just stick with the true crime dramas and the Virgin Rivers and call it a day. So I've been thinking about that a lot. It was a really fascinating podcast. He's clearly a very fascinating and immensely talented artist. And one of my favorite songs that he did was off his 10th album, Love Sexy, Alphabet Street. I was obsessed with the song Alphabet Street, as was a buddy of mine, Sean, growing up. And we would literally run into each other in the hallways in high school just so we could go, well, excuse me. And he does this great, well, it just kind of the song stops and he goes, well, excuse me, mama, or something like that. And we just would go out of our ways to say excuse me to one another in that voice. And I mean that's the level that we were at the time. So and now that I'm thinking about this song again, I'm sure I'll do the same thing to my wife and anybody who's in my proximity. So yeah, this was off his 10th album, Love Sexy. Really interesting video. It's a funny video. I mean, it's the princeliest of Prince videos that you'll ever see. The way he dances, and there's these really cool alphabet letters that are floating around, and there's all these little hidden messages. And one of the coolest hidden messages in the video is at one point there's a little message that pops up that says, "Don't buy the Black Album." So a lot of people don't know this or may have missed this unless you're a pretty serious Prince fan, that his 10th album was not supposed to be Love Sexy. It was supposed to be something called the Black Album. And right before it was released, he said, this is an evil album. This is not who I am anymore. And he had it pulled. And then in its place, Love Sexy was the album that they put out. I believe this was 87, I believe. 86 was Sign of the Times. Amazing album. This was 87. Eventually, the Black Album, I think it was sometimes called the Black Bible or the Bible Album or something like that, was released, I believe, in 94, but to not much fanfare. But really interesting that Prince really kind of disavowed this album. Don't you love? We should do a whole show about disavowed albums if that were a thing. But anyway, love this song. Listen to it. Alphabet Street is the catchiest song that may have ever been recorded and probably one of the best videos. So let's get into it. Hypnic, oops, Hypnic Myoclonus. Sorry, if you heard that, that was my David Bowie, You Got a Message, from Ashes to Ashes. That's my message indicator, and it drives my wife crazy. You got a message. So anyway, so hypnic jerks, hypnic myoclonus, sleep starts. There's a bunch of names for this phenomenon that probably once a week somebody asks me about. In fact, it popped in my mind because during spring training, a baseball player was talking about jerking when he falls asleep. That sometimes he's aware of it, sometimes he's not. His girlfriend is very aware of it. He's a big guy. And as they're sitting there watching White Lotus or whatever they're doing at night, he'll fall asleep on the bed. She's still awake, and there's this big jerk, a few seconds after he kind of falls asleep. It often awakens him, and it often is accompanied by some sort of dream, the most common being falling, that you've kind of drifted off quickly. You suddenly dream that you're tripping down some stairs, or when I do it, I'm always stepping off a curb and I kind of miss it and I'm going to fall. And that's where I wake up. I actually was, one time I had one where somebody was throwing me like a ball and I noticed the ball coming at me. I was not going to be able to react to it in time to catch it, and that woke me up. So there's usually some sort of physical danger involved with the dream. So these events or phenomenon have multiple names. That the typical term we use is hypnic myoclonus, but they've had lots of names over the years. Sleep starts is one that I always like because it happens at the beginning or the start of sleep. Hypnagogic jerks. When we talked about narcolepsy, we talked about hypnagogic and hypnopompic hallucinations. Hypnagogic meaning as you're going to sleep. I always remember the go and gogic, go to sleep. And hypnopompic is you're arising from sleep. These involuntary twitches that happen as we transition from being awake to being asleep. And these jerks are very sudden. They can be kind of dramatic. They can involve the whole body or just your arms, just your legs. Um, in addition to feeling like you're falling or frightened or threatened, there can be associated light with it at times for some people. And for some people, there is a noise, and that's not to be confused with exploding head syndrome, which is kind of similar where people hear a loud, crashing noise and maybe a bright light and they wake up in a panic thinking they've had a stroke. There's often a lot more fear involved with exploding head syndrome than there is with hypnic myoclonus. They can occur multiple times, but generally are sort of confined to the space in and around the beginning of the night or that transition period from going to sleep, from being awake to going asleep. So it's not something that you would typically experience throughout the night. So as you're thinking about this, that's the important part of the differential diagnosis. If somebody says, I'm jerking and twitching from the time I go to bed until I wake up, might be something different. Or if somebody says, I don't feel it at all at the beginning of the night, but during the second half of the night, I feel like a lot's going on. The first and second half of the nights are so different. We have so much more deep sleep up front, so much more REM sleep during the back. So somebody with periodic limb movement disorder or restless legs, that's more of a continuous thing that happens for several hours at the beginning of the night and then tends to fade off towards the second half of the night. A lot of jerking in the second half of the night, but not the first half. You have to think about REM-related phenomenon or even something like sleep apnea, which we talked about last week because of the paralysis that happens during REM sleep, that you might be having more breathing disturbances during the second half of the night. They're awakening you from sleep and causing that sleep disruption that you're feeling. And because it's in and around REM sleep, there can be dream-related phenomenon that happen with that as well too. Typically, hypnic myoclonus is thought to originate in the brain stem, kind of in the part of the brain where the heart rate is happening, breathing is being controlled, sort of the automatic parts of your nervous system. And what's really cool is we don't typically do sleep studies for these individuals unless there's sort of a diagnostic concern that is this hypnic myoclonus? Could this actually be some sort of sleep-related seizure? You see this a lot more in younger people. So when you actually hook people up for an EEG, they're often associated with something called vertex sharp waves, where as the individual's falling asleep, you see these little sharp, very distinctive. I'll put a picture of them up on my social media, my Instagram, Dr. Chris Winter, to show you kind of what they look like. Sometimes that hypnic myoclonus is associated with this vertex sharp waves, but again, that big movement often makes seeing what's happening on the EEG a little bit difficult because that big sudden movement can kind of obstruct what you see in the EEG a little bit. Really interesting. So people, well, so why? Why are we having these things? A lot of people, I always think about this as a rough transition from wake to sleep, meaning, if you're getting your sleep, you're on a good schedule, getting your exercise, doing all the things you should be doing, you get into bed, and we've talked about a typical sleep latency, 5, 10, 15, 20 minutes. It's not instantaneous, right? We always worry about people who get in bed and they're asleep, before their head hits the pillow. That often indicates sleep deprivation, that your body's so hungry for sleep that as soon as you get even close to a horizontal position, you're falling asleep. So when you think about hypnic myoclonus, it's like a sudden, rough, not smooth transition into sleep that where you often see that. So sleep deprivation is certainly one of the risk factors for it. So I always tell people, hey, if you're experiencing a lot of hypnic myoclonus, tell me what's going on in your life. Well, I've got a project due. I'm in midterms. We're going through a divorce. We're moving and we're packing our house, and it's just kind of a nightmare because we have 3 kids too. So usually there's an indicator like that. Another really interesting theory that I had never heard until recently about hypnic myoclonus is that it might relate back to when, our primitive ancestors were rubbing sticks together to make fire and hunting woolly mammoths and sleeping in trees to avoid predators. Although there's a lot of predators that can easily climb a tree. In fact, when I think of a lot of predators, don't they like kill you and drag you up and throw you in a tree and kind of munch around on you and keep you protected up in the tree? So I'm not sure how great the tree is for hiding out from predators. But the thought was that if you're hiding from a predator in a tree, at some point you got to sleep. Remember that scene in the Hunger Games where like Katniss is up in the tree and they all know she's up there and they can't really get to her. They're kind of trying to wait her out and she drops the hornet's nest on them. It was just awesome. But that idea that you've got to almost tie yourself into the tree so that when you fall asleep, you don't follow the tree. So the thought is that hypnic myoclonus, that jerk, acts like sort of a bracing movement to brace you if you fall asleep in the tree and start to fall out, which I don't know who came up with that, but that's just awesome. I feel like I'm running out of time to create some sort of theory, whether it's true or not, that people, oh my God, that's a crazy theory. Dr. Winter has this crazy theory that the reason why we do X is Y. I'm not going to mention this person by name, but some guy was like, the reason why people who have meth addictions have terrible teeth is because they sleep with their mouth open, which was about the dumbest thing I've ever heard. And of course, and so then you wonder, like, you're a smart guy. Like, do you really believe that? Or do you just put that shit on there so people like respond to it? And, of course, everybody's like, no, I don't believe that. I don't believe that. And at one point, somebody said, I don't think that's true. I think it's because of the chemicals in this. And then there's like 10 different reasons for it. And his response was, well, that's what the dentists tell me. Okay. So anyway, I love it. I love a good theory, but I like when we present it as theory and not fact. Um, so again, this is a normal response to the relaxations of our body. So think about your body awake, and as you transition to sleep, a lot of muscles need to relax. So generally speaking, if we're doing the things we're supposed to do for our body, that transition becomes smooth. We smoothly go from being awake into a transition sleep, into a light sleep, into a deep sleep, and 90 minutes later we have a dream, and off we go for an amazing 6.5 hours of sleep, just like Amber got um, after reading my book. We're still thinking about you, Amber and Allison, as we do the podcast. We hope you're not experiencing any hypnic sleep starts whatsoever. So again, this is a normal response to the abnormal situation. So what things might, potentially cause it? There certainly are sleep disorders, REM behavior disorder. You do get into a little bit of the movement disorder, Parkinson's crowd. So if you're somebody who's like, look, I've never had this happen to me once in my life. I'm 60 years old, slowing down, a little bit of a tremor, a little bit of a mass face, think I might have a little bit of that kind of Joe Biden look. People are concerned about Parkinson's disease, etc. Yes, maybe this thing could be a heralding sign of something more serious, More often than not, it is not. Ask me, Chris, in your experience, how many times have you dealt with hypnic myoclonus where it has been the harbinger of something bad or dangerous or problematic? I can't think of one time. Now, I think that a smart sleep doctor might say, yeah, Chris, because you're missing it. That could be true, but I am a neurologist. I mean, I can smell Parkinson's disease a mile away. So I'm not, I don't think that I am missing it. I think most causes of this are completely benign and relate to sleep deprivation, certain medications, caffeine use, etc. So we don't want to always assume benign, especially if it's kind of out of nowhere and really aggressive and doesn't have an explanation. But I don't want you to panic if this is something that has happened to you. It's happened to me plenty of times. Stress is a big one. Sleep deprivation, stress plus sleep deprivation, even worse. Alcohol can do it. I had a Negroni last night and slept so badly, so badly. Like I got kicked out of the bed at some point. And it was just, it wasn't that big of a, I mean, the whole drink was a big ice cube. I mean, it was just like an ice cube with little droppers of Negroni around. I mean, so, but it's just amazing how bad alcohol, especially this was alcohol late at night. Friend of my wife's came into town who's just awesome. And we were talking. And we all had a drink. And oh man, did it, blow me away. So I am certain I was having hypnic myoclonus and cataphrenia and all of Dr. Winter's greatest hits, the moaning, the shifting around, the hypnic myoclonus where I think I'm falling downstairs. Like we were doing it all, probably some heavy breathing and snoring to boot. Even a mystery track at the end of the greatest hits album. Who knows? But yeah, I got kicked out pretty summarily. Anyway, how do we diagnose this? It's a clinical diagnosis. My guess is a lot of listeners who are listening to this right now have diagnosed yourself. That's awesome. You actually get to bill yourself for it. You've just made a sleep diagnosis, hypnic myoclonus. I'm sure there's an ICD code that I do not have memorized. And yeah, you can bill your consultation rate for that if you'd like. So or if you visit friends and they mention this to you, like, oh yeah, it's hypnic myoclonus. It's benign. It's a transition from being awake to sleep. As your body lets go of voluntary muscle control, that'll be $120 or your $60 copay. There you go. How do we treat it? There really isn't a treatment necessary. Generally, the treatment 90% of the time is get your sleep, get your exercise, stop drinking Negronis at night, etc. Caffeine at night, not great. Because I made my friend who's into town an espresso martini. So that's a double whammy, right? Let's put a shot of espresso in with some vodka and some coffee liqueur, and let's see what happens in bed tonight. Let's see what happens. Medications sometimes can be prescribed. There are medications that you can use. The conversation I often have with patients is, look, this medication may help with the myoclonus, but there might be a side effect, an effect on your sleep that's not great. Clonazepam was used for a long period of time and still is, but that is a medication that does tend to suppress deep sleep. So, pick your poison kind of thing. Hypnic myoclonus is pretty harmless. I've never had any patient injure themselves or somebody else. It's usually just kind of startling, like your partner sitting there reading their book and you have this like kind of convulsion and wake up. And I've done that. And you kind of look at your partner, and my wife looks back at me like, what the hell was that? Like, you're like, oh, I was dreaming like I was running around. I came some stairs and I tripped on the first stair and I could feel myself getting ready to fall head first down the stairs. And then I woke up. So it's so interesting, isn't it, that it's so commonly related to falling that it really makes that falling out of the tree thing make a lot of sense. Like there's a lot of situations you could respond to, like, being thrown a ball, a car making a funny turn and getting ready to hit you. But it tends to be falling, which is pretty interesting. There was a 2018 study that said, look, basically this is harmless, but there is new evidence that certain diseases might be related to this Parkinson's disease, migraines to some extent, some neurological disorders, other movement disorders. So it's again, let's not dismiss things if we have a sense in ourselves that I'm 50 years old and have never had this happen. Over the last few months, it's happening a lot. And I am not drinking caffeine and I'm exercising. I'm doing all the right things. I think it is always, when in doubt, worth talking to your doctor about. A lot of people worry about being epilepsy, same thing with exploding head syndrome. Generally not, but again, could be. So if you experience hypnic myoclonus along with other symptoms, if you've had seizures before, any bizarre loss of consciousness, any bizarre lingering of effects. Like usually once I wake up, there's a startled nature to it, but it's over. There is nothing left. And especially after what we were talking about last week, if this seems to be associated with excessive daytime sleepiness, do the Epworth. Are you scoring higher than 10? So if there's high Epworth, high excessive sleepiness, unusual time frame, never happened in the past, happening now, associated with some other, concerning neurological problems, please bring this up with your doctor and talk to them about it. So that's it. I wanted to keep it short, keep it sweet. Hypnic myoclonus, sleep starts, done and dusted. Have you ever had them before? If you have, what is the dream phenomenon that goes along with it? Let me know. And we'll talk about it next week during our April Fool's Day episode, which will also be an Insomnia Monday. So we have a lot going on next week. Thanks for listening to the podcast. Follow me, Dr. Chris Winter, Instagram, Twitter, Bluesky, Threads. Check out the YouTube page. Check out our Spotify music playlist. We will definitely be adding Prince's Alphabet Street to that list. And like and subscribe to the podcast. We always appreciate that. And until next week, sleep well.